This is part 2 of a 2-part series on 14 keys to recovery from COVID-19, including the second 7 keys. Watch carefully because these keys could save your life. To see the first 7 in part 1, please subscribe to this channel and look for the previous video on the first 7 keys to recovery.
Nation being addicted.
Dr. Terry Shintani, Director of Preventive Medicine at Florida.
Hi, this is Dr. Shintani for your health. Here are the second 7 of 14 keys to recovery from COVID-19. We need to be aware that we absolutely have to open the economy because poverty can cause death just as COVID can. But we have to open carefully and prudently, otherwise we'll have a resurgence of the virus and we'll have to shut down all over again. Here are 7 more keys to careful recovery from COVID-19. Number 14 could save your life. Number 8, COVID-19 is much more contagious than the flu. Part of the real danger of COVID-19 is that it is so much more contagious than the flu. Its R0 rating is 5.7 compared to that of the flu, which is 1.3. See our previous video as to how this actually exponentially increases the number of cases and why we had so many deaths in such a short time. We've had actually 3 times more death in the first 2 months of COVID-19 as we had all year last year with the flu. Let me put it another way. With a 0.26% infection fatality rate and with around 147,000 deaths as of July 23rd, the number of actual infections would have to be around 56,670,000 in order for 147,000 deaths to add up to be 0.26% of the infections. Some people have suggested that we've been overcounting COVID deaths. So let's say that the actual number of deaths is 25% less at around 110,000. That would still mean that we have had around 42,307,000 infections to result in 110,000 deaths being 0.26% fatality rate. The problem we expose here is that we've detected only 4.1 million cases as of July 23rd. In other words, no matter how you look at it, we're probably missing over 90% of the infections in the United States, and there have been tens of millions of undiagnosed carriers living in the U.S. Number 9, asymptomatic transmission. It now appears that COVID-19 can be transmitted by asymptomatic people. This could explain why there are so many undetected cases in the U.S. After denying asymptomatic transmission all along, the World Health Organization can no longer ignore the evidence and is changing its stance. This is why wearing a mask is important. Physical distancing is also helpful. Remember that we all need to behave as if we are asymptomatic carriers and wear masks or face shields and keep our distance to protect others as well as ourselves. Number 10, COVID-19 may be spread via airborne transmission. It is now believed that COVID-19 may be transmitted via airborne transmission. This helps to explain why COVID-19 is so contagious, and it's another reason why wearing a mask is important. Face shields may be even better because it protects our eyes. Airborne particles can also settle on surfaces, so washing hands and surfaces with soap and water is best. Sanitizers with at least 60% alcohol is also effective. See our video on hand washing in our YouTube channel. UV or ultraviolet C light can sanitize a room and other things. Number 11, mitigation measures lower the contagion rate. Because the real danger in COVID-19 is its high contagion rate, just remember that the mitigation measures of wearing a mask, washing hands, wearing a face shield, and keeping distance is to lower the contagion rate. Contagion rate is rated by the R0 value. The R0 value is based on the number of people an infected person is likely to transmit the disease to. For the flu, for example, the R0 value is 1.3. COVID-19 is much higher at 5.7. If you understand that these numbers actually operate exponentially, you will see why COVID-19's infection rate is what is very dangerous about it. See a previous video on don't make this mistake to understand the R0 value. So if we are able to put in practice enough mitigation measures, the R0 value will start to decrease dramatically. This is what's called bending the curve. And if we can get the R0 value below 1, we will gradually start to see the disease disappear. This is the goal of our mitigation measures of wearing masks, physical distancing, wearing face shields, washing hands, and so forth are important. Number 12, a second wave of COVID-19 is already beginning to take shape. Because many people have not learned these lessons or are not observing precautions, we now have the highest new case numbers in the U.S. that we have ever had. While a lot of this is due to greater testing, the increase in mortality is starting to show up. As I mentioned earlier, there's about a 2-week lag between a surge in cases and a surge in deaths. See my video on Don't Make This Mistake. It would be a dumb way to die. Number 13, don't forget that age and comorbidities are risk factors. And the people who have comorbidities such as obesity, heart disease, hypertension, diabetes, and cancer should be much more careful and be sequestered from the risk of exposure. Number 14, you can do things to protect yourself against COVID-19. Besides preventing the spread with a mask, etc., there are other things you can do to protect yourself from COVID-19. Think about it. Most of the comorbidities that increase the risk of death are reversible, such as high blood pressure, diabetes, heart disease, and obesity. These can be reversed or at least improved with diet and lifestyle. So now would be a good time to cook at home, eat in a healthy way, and make this time like a health spa time to eat healthy and build up your resistance to this and any other disease that may come along. My programs have demonstrated that you can make significant improvement in all of these factors in just 10 days. For information on how to do this, see my book at peacediet.org and subscribe to my YouTube channel and see my previous videos on these topics. After all, the threat of COVID-19 is likely to be around for several more months, so you have time to get healthy. And don't forget to see my previous post on 10 ways to boost your immunity against COVID-19 so you can build up your resistance even more. Remember, we need to open the economy, but we need to do it carefully. These 14 tips will help us do just that. I hope you found the second 7 of 14 keys to COVID-19 recovery helpful. To see the first 7, please subscribe to this channel. Click on the bell for notifications and look for our previous video on part 1 of 14 keys to recovery. This is Dr. Shintani for your health.